And our next lecture will be online. It's my pleasure to welcome Yehuda Tagar, originally from Australia, but now based in Slovakia, a psychotherapist and a trainer of psychosomatic therapists. He is the founder of Psychophonetics and Methodological Empathy, and he directs the Psychophonetics Institute International and the schools of empathy across multiple countries. Today, he will discuss how psychophonetics empowers patients to take an active role in their healing journey. I'm here. Oh, we can see you and we can also hear you, so you can start. Please welcome.
I hope you hear me because I don't hear you. My name is Yehuda Tagar, and I'm director of Psychophonetics Institute International, Psychosophy Academy of Central Europe, and Škola Empathy in Slovakia and Czech Republic and China. I want to present to you at the same time a general idea, an ideal, and a modality that can do it. The client as an expert in the client's own experience, I believe it is the future of medicine. We call it participatory therapy. Namely, the client is a colleague in the actual therapeutic process. Well, the client is always a colleague, but in many, many modalities of medicine and therapy, East and West, the client remains a passive recipient of the treatment. And we believe this is a loss of a huge resource of the client's self-awareness, self-sensation, and self-knowledge. But of course, they don't have a language for it. They can tell us only about symptoms of it. We have to translate it, we therapists have to translate it into our body of knowledge. But what they can tell us is only a tip of an iceberg of what they know about themselves. In Škola Empathy in Slovakia, we are teaching people to become partners and colleagues in a therapeutic team, to be real participant in the process. But of course, the major impediment for that is that they don't have a language with which to describe in words to our language what is happening to them. So we are losing normally on all the incredibly rich and valuable resource of their self-sensation. Psychophonetics is a modality of expression therapy, integrative expression therapy. It's not just art therapy, it is expression therapy, including two major processes: methodical empathy and the action phase in which the client is, through self-empathy, expressing what's happening in them. How do I express what's happening in them? Alongside methodical empathy, we developed 4 modes of communication that enable everyone to communicate with themselves and therefore with everyone listening to them. Alongside the reflective mind, we developed the activation of the imaginative, the ability to see themselves, the inspiration, the ability to hear themselves, and the intuitive mode of communication with which they can wake up to what they know. And we listeners, we practitioners of psychophonetics, we can communicate to them on the same channels. And together we become a team, a very effective team of colleagues. We bring the process, we bring the background knowledge. They bring the direct, visceral experience of themselves. And together we become a practical team, having a common language for that. And I know it's difficult to imagine it until you see it, but I only have a few minutes here. And so behind me, these communications to our whole body of knowledge. We were and are teaching it in Australia, South Africa, UK, and Slovakia, and now in China as well online. So how do we do this? We developed a form of listening that enable us to hear more than the words that the clients speak. We develop perceptions on a deeper level, enabling us, without questions and advice, to hear what they mean, not only what they actually say in words, and confirm it with them. It became a practical, active dialogue, interactive dialogue between therapist and patient. And we develop our own language on the spot between the two of us. And then, on the basis of this picture that we now have in common, we invite the client to make a wish, to give a direction to the process, putting them in the director's chair. And from there on, after they express the wish, we go into the action phase. In the action phase, we integrate all the expressive modes human beings have. Sensing and gesture and visualization and the sounds of human speech. And it becomes a form of self-therapy, which the client can take home with them and continue. The sensation is obvious. They can sense themselves, and we can develop this ability to sense into a real connection to the body through self-empathy. Then the people can describe it. Further to this, we do a gesture, a spontaneous gesture of what's happening inside. There's a word for it in German, Gebärde, coming from geboren. People give birth to themselves through gesturing what's happening with them. And then we use the sounds of universal human speech. We can apply a combination of the sounds of speech to every human experience, release it, enhance it according to what is needed. And this is an extension of the Kabbalistic and the Ayurvedic and the Qigong tradition and the Aboriginal tradition. We all use human speech non-intellectually, as babies do when they learn how to speak. They use sounds. We bring it back. And with this combination of elements, people can become their own explorers, their own healers, their own teachers. And then we address the whole range of possibilities that otherwise we only have to deal with people as objects. We are dealing with stress management and pain management and chronic fatigue syndrome and burnout and autoimmune syndromes and migraine and other headaches, skin issues, including eczema and acne and hay fever, irritable bowel syndrome, ulcer, viral issues like herpes and post-viral recovery, postural integration, scoliosis, breathing issues, asthma, and of course, anxiety, depression, grief, all the topics of normal psychotherapy and addiction. And we can provide a practical process for the recovery from abuse and trauma. When the client participates in their own process of recovery, observing their own psychosomatic continuum, they become practical colleagues in the therapeutic process. Well, friends, that's all I have time to share with you today. The rest you can find in Yehuda Tagar and in psychophonetics and in methodical empathy. And we teach it in Czech, in China, in Slovakia, and in the UK. I'm looking forward to hear the rest of you sharing your work. Thank you.